Hey everyone! Today, we'll explore the factors that make individuals with SMA more vulnerable to infections, the challenges they face, and what can be done to minimize risks. So, let's get started. Understanding SMA and the immune system. Spinal muscular atrophy is a genetic disorder that causes the degeneration of motor neurons, which leads to muscle weakness. The impact of SMA is most often seen in the muscles responsible for movement, breathing, and even swallowing. But did you know that it also affects the immune system in some cases? To understand why fighting infections is more difficult, we need to first look at the immune system. Our immune system works like a defense army, protecting our bodies from harmful invaders like bacteria, viruses, and fungi. But, in individuals with SMA, several factors contribute to a weakened defense system, making it harder to fight off infections. The role of weak respiratory muscles. One of the key challenges for individuals with SMA is weak respiratory muscles, including the diaphragm and intercostal muscles. These muscles are essential for taking deep breaths, coughing, and clearing out mucus. Without strong respiratory muscles, people with SMA are more likely to have difficulty clearing mucus from their airways, which creates a perfect environment for bacteria and viruses to thrive. This is why respiratory infections are a common concern for those with SMA. Mucus buildup can lead to pneumonia, bronchitis, and other serious respiratory issues, which are harder to manage without the ability to clear the lungs effectively. Impaired cough reflex. Another challenge individuals with SMA face is impaired cough reflexes. Coughing is one of the body's natural defense mechanisms. A strong, effective cough can remove irritants, mucus, or foreign objects from the airways. But in SMA, muscle weakness, particularly in the respiratory system, can hinder the ability to cough forcefully. This makes it much harder to expel bacteria, viruses, and other pathogens from the lungs, which means infections can set in more easily. And if an infection takes hold, it becomes more difficult to clear it from the respiratory system, leading to prolonged illness or complications. Swallowing difficulties and aspiration risks. Swallowing difficulties, also known as dysphagia, are another issue that makes fighting infections harder. For individuals with SMA, the muscles that control swallowing can become weak, leading to difficulty ingesting food, liquids, and even saliva. When swallowing is impaired, there's an increased risk of aspiration, which occurs when food, liquids, or saliva mistakenly enter the airways instead of the stomach. Aspiration can lead to aspiration pneumonia, a condition in which bacteria from the mouth or throat enters the lungs, causing infection. This makes people with SMA more prone to developing pneumonia and other respiratory issues that are difficult to treat. Reduced mobility and sedentary lifestyle. Reduced mobility is another contributing factor. For individuals with SMA, limited physical movement and a sedentary lifestyle can have serious impacts on the body's ability to fight infections. When the body isn't able to move around freely, the lungs don't expand fully, and the airways aren't cleared as efficiently. In addition to weakening respiratory function, reduced movement can also affect blood circulation. This means that white blood cells, the body's infection-fighting cells, may not be able to travel as effectively throughout the body to target and eliminate harmful pathogens. As a result, infections are more likely to spread and take hold in various parts of the body. Impact on the immune system. Although SMA itself doesn't directly attack the immune system, the challenges it causes in respiratory function and mobility can make the immune system less effective. In some cases, people with SMA may experience a weaker overall immune response because their bodies are constantly fighting the effects of muscle weakness and fatigue. This makes it harder for the body to defend itself against infections effectively. Furthermore, individuals with SMA may require more frequent hospital visits and treatments, which can increase their exposure to germs and infections in healthcare settings. This means that the risk of catching infections in the first place is also higher for individuals with SMA. How to support the immune system in SMA? So, what can be done to help support the immune system and reduce the risk of infections for individuals with SMA? Let's talk about some important strategies that can make a difference. 1. Airway clearance techniques. Using devices like cough assist machines, suction machines, or incentive spirometers can help clear mucus from the lungs, which reduces the risk of infections. 2. Vaccinations. Make sure to get vaccinated against flu, pneumonia, and other preventable diseases. Vaccines are an important defense against infections that can lead to serious complications. 3. Proper nutrition. Good nutrition is vital for boosting the immune system. A healthy, well-balanced diet can support overall health and give the body the nutrients it needs to fight infections. 4. Respiratory therapy. Regular respiratory therapy and physical therapy can help strengthen the muscles involved in breathing, coughing, and swallowing, reducing the risk of respiratory infections. 5. Infection control practices. Practicing good hygiene, avoiding exposure to sick people, and taking precautions when visiting hospitals or healthcare facilities can help prevent infections from spreading. Fighting infections can be a challenge for individuals with SMA, but with the right strategies in place, the risks can be minimized. By understanding the factors that contribute to a weakened immune response, we can take proactive steps to protect health and improve quality of life.